let me be clear about what this means. It means that families paid more.
The lawsuit alleges that MultiPlan worked with 8 insurance companies: Aetna, Cigna, United Healthcare, Humana, Elevance, Molina, Centene, and the Healthcare Service Corporation to collude to keep insurance payments to doctors artificially low, forcing more and more money to come out of patients' pockets. Attorney General Kris says the insurance companies share their confidential information with MultiPlan, and MultiPlan would set fees for all of the companies, eliminating competition.
This is not how our healthcare system is supposed to work. This is not how insurance companies are supposed to operate. And this is not what Arizona families deserve.
And May's stressed this doesn't just impact patients who pay thousands beyond what insurance will cover. She says it has a big impact on medical providers. Mays was joined by Dr. Andrew Carroll, a family medicine doctor from Chandler, who says these billing issues have made it hard for a private practice to survive.
For years, my colleagues and I have seen the same pattern. We provide care, sometimes, often in emergencies, sometimes for complex conditions every day, and insurers offer a payment which barely covers our expenses.
Now, a vice president with MultiPlan told us, quote, "We are aware of the complaint filed by the Arizona Attorney General against MultiPlan and strongly disagree with it. The allegations are without merit, and the company stands by its position that it complies with state and federal antitrust laws." We also reached out to the companies involved for their response. An Aetna spokesperson told us, "We deny the allegations and will defend ourselves vigorously." The Healthcare Service Corporation told us they do not comment on pending litigation. The Attorney General wants the court to stop the companies from operating this way and return the money to patients and providers and face civil penalties for their conduct. In the newsroom, Jason Berry for Arizona's Family.